Tonight on Joy News Prime, Ghana's COVID-19 case count goes beyond 9,000, with 42 persons now known to have succumbed to the disease. Despite the gloom, though, frontline health workers involved in the fight against the pandemic at the LWAC Isolation and Treatment Center have delivered their first baby born to a COVID-19 patient through cesarean section.
Patient is doing very well. Baby too is also doing very, very well. It was pure joy, pure joy. But she was even shedding tears. You know, how else can you express such joy? Otherwise, I said everything went on smoothly.
Foreign Affairs Minister assures more than 1,000 Ghanaians stranded abroad as a result of the closure of the country's borders should be evacuated home before the end of June.
Our mission in Abu Dhabi and consulate in Dubai have initiated discussions with the UAE authorities for the evacuation of over 500 of our nationals who are stranded in that country.
Also in this bulletin, President Akufo-Addo inaugurates Tema Motorway interchange the opposition NDC insists is the legacy of former President Mahama.
We know that the so-called unprecedented infrastructure development of the Mahama administration was fantasy, existing in the Green Book and not on the ground.
And in business, vegetable production in Ashanti region takes a hit in wake of COVID-19.
Price and I want to mean say I didn't be more. No more na bia na san ko fa enkro nti sekua no atofo ne ba na bo na be ko no shit bia na so wan te asema no ja kwa obotutu egu.
And imagine having to risk being run over by a vehicle just to make a phone call. That's the life of the people of Salifu Chrome in the newly created OT region.
Some of them, they are baby nurse, lactating mothers, which by this time they have to be in the room making call. But because of the network problem, you see them around the roadside.
That's what you call a life-threatening phone call. I'm Israeli anchoring Joy News Prime live on your digital terrestrial TV because we're free to air.
My name is Aisha Ibrahim, coming to you live from our studios in KOMENDA on digital address GA0992539, also on DSTV channel 421 and GoTV channel 144. Please stay tuned in.
Ghana's COVID-19 case count on Friday went past the 9,000 mark to 9,168 confirmed cases. Now, 4 more deaths were also recorded, taking the death toll to 42. The recoveries have also gone up to 3,457, leaving the country with 5,669 active cases. So the regional breakdown, or before we get to the regional breakdown, there are the 4 new deaths from 2 regions, Ashanti and Greater Accra region, and the ages are between 46 and 71. 1 died of hypertension, diabetes, and mellitus, and diabetes, mellitus, and hypertension, and then hypertension. Now to the regional breakdown of the cases that we have. All right, so we do not have the regional breakdown, but also in the bulletin, or it's not being all gloom actually, because in that gloom, there's still some joy that comes out. Now, conducting a cesarean section, though complicated, is not rocket science. But when it involves a COVID-19 pregnant woman, doctors say the potential complications multiply, especially as the medics involved are having to conduct the procedure in full PPE to reduce the risk of infection. Well, doctors at the COVID-19 Isolation and Treatment Center at LWAC Stadium have pulled it off, and baby and mother are doing well. Joy News' Beryl and Estina Risha had exclusive access during the surgery, and as far the following report.
It is 12 p.m. at the LWAC Isolation Center, where about 30 persons with COVID-19 are being kept and treated. 2 of them are pregnant, and one of them, who does not want to be identified, is about to go through a cesarean section she had arranged for earlier. It's a few minutes to the procedure. The medical team, clothed fully in their PPEs, ready themselves, tightening all loose ends. Unlike other surgeries they have done, this one requires leaving nothing to chance.
I have with me here one of the members of the medical team who would perform this operation on the pregnant woman with COVID. We are joined by Lieutenant Colonel Asari.
What does it all entail? As you can see, we are all in our PPEs as well, knowing quite well that we are going to deal with a condition that is highly infectious as well. So the patient will come in here, and then we will clean the back. After cleaning the back, one of my team members here will now give what we call a spinal anesthesia. And in this case, we are just going to instill some few mils of a local anesthetic agent into the back. And that will numb her from the nipple downwards. That will also facilitate us finishing with the surgery.
Lieutenant Colonel Michael Asari is an anesthetist and will be supported in today's surgery by obstetrician gynecologist Lieutenant Colonel Frederick Ajarijan.
Basically, nothing different from the regular cesarean section, except we know that because of the patient's unfortunate infection with COVID-19, we need to take precautions for mother and for baby, and for the team members who will be involved in the procedure. But we don't expect anything untoward or anything different from what a normal cesarean section would be. It's been days. We've been planning all of this out for a couple of days. We've spoken to all the teams. We brought in clinical psychologists to speak to the patients. We have pediatricians who are on standby and will be present in theater to act if there's any requirements for that purpose, because you are not working in normal hospital environment.
At this point, me and the camera technician have to wait outside the theater for the surgery to go on.
As he said, we shouldn't expect anything different. The only different thing is they are clothed in full PPE. And he makes us understand that his team is well prepared for any excesses that will result after the surgery. We'll hang around, we'll hang outside. Immediately after the surgery is done, we'll get back to the team to find out how it all went. But we wish them all the best.
It took about 1 hour for the baby to be taken out of his mother's womb. Lieutenant Colonel Ajarijan and his team savor a proud moment.
Well done.
Thank you very much. So generally, as said before, it went as planned. There was actually no any aberration from the normal. What we did was what we'd expect to do anywhere else. And as I said earlier on, except for the fact that the patient unfortunately has been tested COVID positive, there wasn't anything else that went.
The anesthetist at the center is excited about the success of the surgery.
As I told you, we've been practicing these things over and over and over again. And so intra-op, everything went smoothly as planned. It was uneventful.
We're told both mother and baby are well, and the mother is also excited.
Patient is doing very well. Baby too is also doing very, very well.
Can you tell us the expression of the mother's face when the baby came out?
It was pure joy, pure joy. Like she was even shedding tears. You know, how else can you express such joy?
For months, the world's focus has been aimed at battling a pandemic that's wreaked havoc across nations. And whilst efforts are underway to find a vaccine, it is not yet clear the level of risk for pregnant women with COVID-19. The psychological burden for these women, however, can be traumatic, according to Major Kwabena Tente, who is a clinical psychologist at the Elwa COVID Center. He spoke to me ahead of the surgery.
In pregnancy, normally in ordinary times, you are anxious about yourself, about the successful delivery of your baby. Even though pregnancy is a joyous moment where you are expecting a child, it is also a very dicey moment where you could lose your baby, you could lose your life, or the outcome can be what all of us look forward to, that is recovery. And naturally, the person will be anxious. What happens to me? What happens to my baby? What are people thinking about me? Okay. You also find out that what will be the outcome? Will the baby be positive? Will it be negative?
The health officials here tell me, with the treatment given, they're hopeful the new mother will be out of the wood in no time. But that will require much more than just hospital care. It is the first cesarean section to be carried out at this treatment center since it began holding and treating persons with COVID-19. The doctors are happy. They hope it will take only a few days for both the mother and the baby, who are being kept in the same room but separately, will be discharged soon. For now, the baby boy will be critically monitored to ensure he does not contract the disease. Crucial times ahead for the team on duty here. Beryl Ernestina Richter's report for Joy News.
Now, the very latest we have on this story is that the mother has tested her first negative, COVID-19 negative, and has been discharged from the hospital. The baby's sample has been taken and we're awaiting results. We're hoping that it's going to turn out negative as well. Now, the use of face masks, medical gowns, gloves, and scrubs as part of precautionary measures to stem the spread of coronavirus has inevitably increased not only the quantity, but the level of such medical waste generated in the country. It has therefore become imperative for authorities to devise ways to dispose of such waste safely. In the following report, my colleague Latif Idris interrogates how the country is managing the disposal of the waste being churned out on a daily basis at health centers.
The tons of PPE donations by Chinese billionaire Jack Ma and the Chinese government to help the government of Ghana to properly and adequately deal with the COVID-19 situation in Ghana would also translate into the same quantity of waste once these PPEs, like the one I'm wearing, perishes. But in a country that is still struggling to handle and properly manage internally generated waste, I'm curious and I want to find out how the country is managing what I want to call the COVID-19 waste. Very little attention has been given to the somewhat novel and highly hazardous waste being churned out on a daily basis in the country, the African continent, and across the world in the fight against the coronavirus pandemic. Testing, contact tracing, isolation and treatment of patients or persons suspected to be infected with the virus have largely dominated discussions at all levels, relegating the subject of managing the waste to the back burner. The Ghana Standards Authority says it is closely monitoring the local production of PPEs, including scrubs, face masks, and medical gowns, to ensure that at least the consumables are biodegradable, to minimize the burden the waste would have on the already fragile waste management system.
We do expect a lot of litter, and this is where now we come in with the management. We know very well that some sanitation companies, I can't mention their names, but you know the usual ones, have come up to say that they will manage the waste. We will support them to manage the waste, but it's fair to say that as a country, in terms of managing the waste, we are just starting. We are nowhere near what will be considered the best way of managing it, purely because our focus has been shifted elsewhere.
Trade Minister Alan Chematin, whose ministry is spearheading the local production of PPEs in partnership with some private-owned companies, says it is following the highest level of quality inspection to prevent the situation where the waste left behind post-COVID-19 gets out of control.
It is certified by the Food and Drugs Authority and then by the Standards Authority. So you're talking about the highest level of quality inspection before it comes out.
For cleaners working in the corporate world and other public institutions, the outbreak and its accompanying protocol like wearing of disposable face masks and constant washing of hands have made their work even more difficult. This cleaner, who works at the headquarters of the multimedia group at KOMENDA in Accra, tells me they are having to clear a lot more trash than usual.
Because they clean their hands often, and then they dispose their nose masks, and then they remove their hand gloves often. So that's the reason why my work has been increased. Due to the nature of spread of the virus and the potential hazardous onslaught it could have on frontline health workers and the general population, health facilities and centers designated as COVID-19 test centers have been compelled to design smart ways of disposing of the waste they generate. Daniel is a laboratory technician at the Greater Accra Veterinary Directorate.
How we used to handle waste in this facility is different from how we are handling the COVID waste now. We used to have an incinerator over here which is broken down now, so what we do mostly is chemical decontamination. But very hazardous samples which cannot undergo chemical decontamination are taken back to Noguchi for incineration.
Some of the protective equipment like medical gowns and scrubs are single-use, a phenomenon behind the pile-up of COVID-19 waste at the designated health facilities. Authorities at the Ridge Hospital are using an ultramodern autoclave to disinfect the COVID-19 waste before it is discarded. Mavis Agri is head of infection prevention and control coordinator at the Accra Regional Hospital.
All the infectious waste, when they are collected from the point of generation, they are brought here. And here it goes into the containers, and then they are put in the autoclave. And this autoclave operates at a temperature of 160 degrees Celsius. In fact, it's between 140 and 160. So all organisms do not survive in this autoclave.
The Noguchi Memorial Institute for Medical Research, which has so far led Ghana's COVID-19 fight by way of testing for the virus, has, as part of its risk reduction strategy, implemented a sterilization process similar to the Ridge Hospital protocol to decontaminate waste they receive from other health facilities involved in the coronavirus fight. Professor William Ampofu is lead virologist.
Anything inside here is autoclaved. Anything inside is autoclaved in here, and then it comes out, and then it has boilers that feed it with steam under high pressure. Yes, so the pressure rises very high. There's a vacuum also interacting with the pressure to remove the gases, and then the pressure builds up, and that constitutes sterilization at 123 degrees for 20 minutes. All living pathogens and spores will be destroyed.
More resources and community engagement are urgently needed in Ghana and the African continent to ensure discarded medical waste generated in the fight against the invincible enemy does not worsen the already precarious situation on the continent, particularly in downtrodden economies.
Now, more than 1,000 of the many Ghanaians stranded abroad as a result of the closure of the country's borders should be home before the end of this month. Foreign Affairs Minister Shirley Ayoko-Botwe has told Parliament that evacuation has already started, with 7 Ghanaians arriving from Nigeria Thursday. She says apart from the over 1,000 expected from the US and UK, before the end of June, another 675 is expected from China and 500 from the UAE and Abu Dhabi.
Mr. Speaker, government took the decision to begin the process of evacuating our compatriots home following the alert from the World Health Organization that COVID-19 is most likely to remain a global public health issue until a vaccine is developed. The decision was also informed by the data gathered by our diplomatic missions abroad on the categories of Ghanaians who were stranded. For several weeks, the Foreign Ministry and its missions abroad, together with key ministries, departments, and agencies, such as the Interior, National Security, and Aviation Ministries, and the Ghana Immigration Service, have been working closely to bring home stranded Ghanaians in several countries. I wish to also report that negotiations are currently underway between our Beijing mission and Ethiopian Airlines for the evacuation of some 675 stranded Ghanaians in China. Similarly, our mission in Abu Dhabi and consulate in Dubai have initiated discussions with the UAE authorities for the evacuation of over 500 of our nationals who are stranded in that country. The Foreign Ministry is also in discussion with the Scholarship Secretariat and the National COVID-19 Task Force to finalize arrangements to evacuate 141 Ghanaian students who completed their language proficiency courses in Benin last month using STC buses. Now arrangements are in place to evacuate them on the 13th.
Meanwhile, the member of the Foreign Affairs Committee of Parliament, Ras Mubarak, is criticizing government's decision to charge stranded Ghanaians abroad who have the capacity to pay before they can be brought home. The minister says apart from the vulnerable people, all others will pay for both flight and quarantine. But Mr. Mubarak says the move is discriminatory.
She listed 4 categories of people who will be evacuated. Ghana funded, evacuations. She indicated that there are a distressful category of persons who are unable to pay, who would be evacuated, deportees and the rest of it. But one category of evacuees came to me as a surprise, because evacuation should not be hinged on any Ghanaian's ability to pay, right? Every government has a duty of care, and irrespective of class or creed, the government has a duty of care to bring all Ghanaians. For instance, government is bringing Ghanaians stranded abroad on, government funded programs. Okay, what makes them more worthy of evacuation than a Ghanaian businessman who is stranded abroad? And if decisions are taken on the basis of people's ability to pay, it gives you an indication of incoherence in policy.
Away from Parliament, imagine living in a community where making a phone call is not possible. Imagine if the only place where you could make a call or receive a call will require you to risk being run over by a moving vehicle. Now, for members of Salifu Krom, a community in the newly created Ochi region, they do not have to imagine. It is the life they live. Joy News' Justice Bedo has just returned from that community, and here's what he found.
It's the dead of night, and the villagers of Salifu Krom have come to the only place in their town where making a phone call is possible. Salifu Krom is only one of the hundreds of communities here in the Nkwanta South District facing this problem.
Even when I'm standing here, my legs are paining me because of the network, so I'm here.
The challenges here, many of them a direct result of the lack of mobile telephony network, are plenty. Children like 16-year-old Ahiaba Rejoice, who are now home because of a global coronavirus pandemic, are unable to study. No network to enable them use online material to learn even if they wanted to. And even worse, cut off from the rest of the world.
Someone said he'll send me money tomorrow, and I want to call the person so that the person should send me the money. For me, I stand here for 1 hour. Sometimes some people will come here for 30 minutes, 1 hour, to make a call.
Not everyone who comes here gets so lucky. Sometimes the network doesn't come at all. Other times, some pay a much higher price. They are hit by passing vehicles.
If you walk top here for some while, some meters ahead, you see that there are many people around those places standing there. With some of them, they are baby nurses, lactating mothers, which by this time they have to be in the room making call. But because of the network problem, you see them around the roadsides with those films from the vehicles. Then all those babies that are at their backs, or it seems it's affecting all of them.
In many parts of Ghana, the ability to make a phone call is almost taken for granted. But yet in many places like Salifu Krom, it is a rare privilege that many pray to have. Justice Bedu, Joy News, Salifu Krom. in the Uti region.
Back here in Tema, President Akufo-Addo has criticized former President Mahama as the man whose legacy only exists in the NDC's document of infrastructure record, the Green Book. Inaugurating the Tema motorway interchange on Friday, the president described projects the opposition party claims to have undertaken as fantasies that are missing on the ground. Ahead of the inauguration, the opposition NDC had demanded that its flag bearer be given credit for the project having secured funding for it before exiting government in 2017. Maxwell Agbagba, however, reports former President John Mahama did not get the mention the NDC had hoped for.
The new Tema motorway interchange project cost $56 million US. It is a grant from the Japanese government through its agency, JICA. Well, this week we've been hearing controversies about this project, with the NDC and minority in parliament calling for President Mahama to be credited. Many came here with expectations that President Akufo-Addo will address those concerns by the minority and the NDC. But the closest the president came to addressing that issue was a jab to the NDC.
We made a pledge to the Ghanaian people to expand and improve the road network while closing the missing links in the network. We had to make this pledge because we know that the so-called unprecedented infrastructure development of the Mahama administration was fantasy, existing in the Green Book and not on the ground.
He has also been talking about the dualization of the Tema-Aflau roads. He says plans are far advanced to convert the Tema motorway into a 3-lane dual carriageway.
Expansion of the Accra-Tema motorway into a 3-lane dual carriageway with service roads under a public-private partnership arrangement. Evaluation has been completed and we're awaiting approval from the Public-Private Partnership Approval Committee of the Ministry of Finance to engage the contractor.
More than 2,000 people died on Ghana's roads in 2017. In 2018, more than 2,000 people died. President Akufo-Addo has been raising concerns about the high spate of accidents on Ghana's roads. He is calling on the MTTD and other state institutions to help reduce the carnage.
The severity and frequency of accidents on our highways due to overspeeding and indiscipline are a great reproach to all of us. Motorists must be extra careful and disciplined on the highways and resist the temptation of overspeeding. Better roads should be a catalyst for national development and not instruments of death and pain. It is time we brought road accidents in our country under control. The agencies and departments of the Ministry of Roads and Highways, especially the Ghana Highway Authority, in collaboration with the National Road Safety Authority and the Patrol Unit of the Motor Traffic and Transport Department of the Police Service, MTTD, need to intensify their educational and sensitization activities on speed control, axle load control, and road preservation. I appeal to MMDAs to ensure that we do not have a proliferation of billboards, posters, and other marketing ads in and around the vicinity of this project.
So with all the controversy surrounding the new Tema motorway interchange, we've been finding out from the Roads and Highways Minister, Kwesi Amokwata, who deserves the credit for this project. He says it is not important and it's immaterial.
Invitation, a ministry does not invite former president. Protocol-wise, my ministry cannot go and invite a former president to a project like this. I had to invite the sitting president to come and commission the project. You see, as a country and as politicians, I believe that we must be serious, and we should stop this little politicking and I did this, I did that. The most important thing is that within the last 28 months, 2 years, 4 months, this project has been delivered for the people of this country and for our benefit. We are praying that we do the second phase to complete the project. And this project is for the government and the good people of this country. This is what we should concern ourselves.
So should it be remembered as an Akufo-Addo project or a Mahama project?
That is not important. That is not important. No, the most important thing is that this project has been delivered within the last 28 months. Under President Akufo-Addo, this project has been delivered. Period.
And still to come in this bulletin, vegetable production in Ashanti region takes a hit in the wake of COVID-19 pandemic.
Price. And I want to mean Chelsea Chinchas and the Javis. I didn't you do more. No more than you do an answer for our own chronicles. Sequiano out of one bar. No one ever going to be honest. One Tias and Manuja or over to.
There's more in business when we return from this break. And it's time for business. Sandra Penny is here with the very latest.
Yes, we'll be doing vegetable farming in the Ashanti region.
Right, take it
all right. We are indeed celebrating 25 years of joy. My name is Sandra Esinam, and I'm here for business. Vegetable production in the Ashanti region is taking a hit in the wake of COVID-19 pandemic. Farmers say about 60% of their produce continues to go waste. Prince Appiah visited the Peace and Love Vegetable Growers Association, where about 30 farmers cultivate 28 acres of vegetable farmland.
We do lettuce, spray onion, cabbage.
Meet Yabu Esiama, a vegetable farmer at Jinyase, a suburb of Kumasi. He has been farming a portion of this 28-acre vegetable farm for the past 12 years. But he says this year is his worst.
Because of COVID-19, I buy anything. I'm affected my in the past. I can't be at 2% wise and one, best 60% affected. Affected, or can say, the same as I said, Nanka, first, Nanka, Thomas schools, restaurants, hotels, and even a year for party for, they say, Nina, and across the down, but my cousin will be a Yaduma. The bus and I only do an idea, Stella and you do a band. And I say, my dear best 100 best. I was thinking Bianchi 2 covers a week, Some customer banner just would delay be a best 3 days and now 4 days and some was a baby. As I say, I'm only once I'm back, Now I'm out of the one I say.
He and 28 other farmers who cultivate this land are unable to sell their produce because suppliers are reluctant to buy. Their main clients, schools, restaurants and hotels are not operating due to COVID-19 restrictions.
Price. And I want to mean Chelsea Chinchas and the Javis. I didn't do any more. No more than you do an answer for our own chronicles. Out of one bar. No one ever going to be honest. One Tias and Manuja or over to. Since I'm coming, can I say, I'm a did example. And can be a time and I didn't mind, and keep a bit more on the base of 30 cities. But they say, I did 10 cities, you can be more than I am. Because 5 cities, more crana, just say, you crana.
This is a typical example of the impact of the COVID-19 on the vegetable production here in the country. This lettuce bed, we are told, has gone beyond its harvesting time, long overdue, which means in a matter of 3 days, if it is not harvested, will get spoiled because the leaves have begun folding towards each other, which the traders do not like. This means that all the investments made in this particular farm and others similar are going to go to waste.
Normally, need enka 2 acres ni nyina no ka me bon ho ka be se 500 cedis a at the end of month no ka manya cross nka mutumi nya be se 2000 but se see here dey wo ka be se 600 kra na wo wia even 1000 kra na dey se obenya fi se wo dua mo no na sa say.
The buyers attribute this to low patronage of vegetables on the market.
Masai to be at the market akoton.
The situation could improve to address wastage in the system. Prince Apia reporting.
Away from the Ashanti region, in a matter of months, Ghana is likely to disallow the importation of cars older than 10 years to encourage international companies, including Volkswagen and AG, to set up local plants. The new law also provides import duty rebates for companies that manufacture and assemble cars in Ghana. So what would be the impact on the second-hand car market? Take a look at this.
If governments today want to partner with automobile giants like Toyota, Renault, and VW for them to give cars to the public, middle-class persons like you, and it comes at a cost of, let's say, 90,000 Ghana cedis and the deduction of 1,800 Ghana cedis monthly from your salary, would you be able to afford it?
Well, looking at other dynamics, other needs, family, other costs, taking this from my salary, naturally everyone will want a new car. Yeah, everybody at all will naturally choose a new car over an old car. But presently, I'm not sure.
Oh, by way of preference, I prefer a brand new car. It's obvious that it's always brand new is always brand new. I mean, there's no way you can compare a second-hand or used car to a brand new car.
Do you think every Ghanaian can afford it?
The issue has to be with affordability of brand new cars, and it's obvious that considering our economy and the kind of jobs that we do in this part of the world, it's difficult for an average Ghanaian to be able to afford a brand new car.
I prefer something me using it for the first time, so that it's long. When you get a brand new car, the durability is good than you going for a second-hand car. That is my point of view.
In other news tonight, commercial drivers threaten to increase fares by 20%. A look at the story, plus many other headlines in the world of business locally.
Commercial drivers have warned of a 20% fare increment if the government fails to reduce fuel prices latest by June 8, 2020. According to the True Drivers Union and the National Concerned Drivers Association, their members, in adherence to the social distancing directives to aid the fight against COVID-19, agreed to cut down the number of passengers in their trotros and taxis. The drivers say fuel prices are always being increased, but the authorities have refused to allow them to increase their fares, a situation they described as unfair. The government has found a strategic investor for the KOMENDA sugar factory. Trade and Industry Minister John Allan Kojo Tremantin has announced Park Agrotech Limited, a company incorporated and operating in Ghana in the agribusiness sector, he said, would be working with STM Projects Limited, an Indian-based company with vast experience in the management and operations of sugar mills and plantations, both in India and other parts of the world.
That will be all for now. I'm back after 8 p.m. with more business news update. But after the break, we have sports news.
And it's time for Showbiz. Becky is here with the very latest. Hi, Becky.
Hello to you, Aisha. How you doing?
I'm good.
Today, let's start with the gospel music industry. Akese Brimpong, he's been speaking. He's telling his colleagues in the gospel music industry to take advantage of streaming platforms, because that's the way forward for the day, for gospel musicians. So for those of you who haven't taken advantage of it yet, listen.
When a church door is closed, the internet window is open, and so there was a lot of traffic online with regards to streaming, YouTube, Facebook, Deezer, Apple Music, Spotify, and what have you. So if you have your songs over there and you have been able to build some audience over the years, you still are going to make some inroads from there. We just got told that Diana is the most viewed gospel
musician
in Ghana. And she's number 4.
Yeah, on that list.
And that is good news for gospel.
Yeah.
Because in the past we didn't used to have gospel musicians featuring on such lists. So it's good news for gospel. So it means that we need to pay attention to digitization, and it's going to be what will save us in the years to come.
Okay.
So for those who are not taking their digital platforms seriously, now is the time to actually grow some audience on your digital platforms. The world is a global village. There's only 30 million people in Ghana, but how many billions of people in the world?
Let's wrap up with Kanye West. He happens to be
he's the highest paid musician.
I tell you.
Oh my goodness! I want to be his friend. You have his number?
No. So on Thursday, Forbes announced the 2020 edition of its annual Celebrity 100 list and revealed Kanye West as the world's highest paid musician, clocking in with 2020 earnings of $170 million. Yes, really. So that's Kanye West, and I really want to be Kanye West's friends right now.
Thanks so much for bringing us
anytime.
Showbiz. And that'll be it for Showbiz.
Minister for Parliamentary Affairs, Jose Chimensa Bonsu, says it will be difficult for the House to compel the Electoral Commission to appear before MPs to brief them on a roadmap ahead of the 2020 elections. He said he had tried to get them to appear in the House on June 9, but the Commission is insisting on appearing on June 16.
The EC has assured that they'll be here on the 16th. I was trying to pull them to be here on the 9th of this month, which should be Tuesday. That had been my own stand. Unfortunately, it's because I told them yesterday, they've indicated to me that they have to fan out to various places in the district to pursue a course, and that will be coming back the Sunday leading to the 16th. That is why they gave us 16th. In the intervening period, a few issues have cropped up, including the directive by the Supreme Court for them to avail themselves on Monday. That is coming Monday, which is 8th. In this instance, I may want to follow up with them if thereafter they could avail themselves to us before maybe they go out there to the districts, because that only happened yesterday.
Now, staying in Parliament, the House has frozen approval of the Subsidiary Legislation Committee's report on the EC's controversial constitutional instrument after the committee chairman accused the ranking member of doctoring the report. Parliament was expected to debate and approve the committee's report Friday ahead of the maturing of the CI on Tuesday. But Deputy Minority Chief Whip Ibrahim Ahmed told the House Boabenge Samoa had edited and deformed Dr. Dominic Ayene's report, and so the report is not ready.
Mr. Speaker, ordinarily we should not have gotten here. But what actually happened must be stated to clear the air. The report was well written by the chairman. Per consultation building, the chairman showed the report to the ranking member just to go through. The ranking member cancelled the report. So the chairman, as we are talking, the chairman is now writing another report. The chairman, we are not questioning the report that was laid here. But what if the ranking member cancelled the report? So what report are we to debate?
Someone insisted the report is ready and awaiting the signature of the chair of the committee, prompting Professor Michael Kwe to order the chairman to appear before the House to clarify issues. When the chairman, Dr. Ayene, eventually appeared, he insisted his ranking member had indeed altered the report.
5.7 of the report, the draft report, and I told him to confirm if the factual correction that I have made with respect to the number of names that were deleted pursuant to the order of the Supreme Court in Abu Ramadan and Nimako versus Attorney General and the Electoral Commission, whether
that correction, the factual correction, was accurate. And he said he had called the Electoral Commission and confirmed that my recasting of that paragraph was accurate. That is what the Electoral Commission had actually told us. But I did not tell him that this is the report that I was going to sign. I was actually working on the legal basis of the CI. Because under the orders of this Parliament, there are a number of grounds that, I mean, with respect to which we have to decide on the constitutionality of the instrument. And I was looking at those. Mr. Speaker, I haven't finished that aspect of it. So what he has here was just for him to confirm the factual accuracy of the deletion of the 56,000 names pursuant to the order of the Supreme Court. So basically my report, Mr. Speaker, is not ready.
Speaker Professor Michael Quay eventually ordered the committee to spend the weekend to rework its report and bring it back to the floor for approval on Tuesday.
I will ask that the Honorable Chairman should ensure that his committee should meet as soon as possible, even if today, and so on, and then at the next possible day of return, which is Tuesday, the matter will be taken up accordingly. By which time, even on Monday, your report will have been distributed to all members so that we can all effectively take a good debate.
Now, the New Patriotic Party's Conflict Resolution Committee is dealing with at least 78 petitions it has received from concerned and aggrieved members ahead of its primaries in 168 constituencies later this month. The party's Director of Elections, Ivan Sinmako, told Roland Walker on the AM show on Joy News, while these petitions are being dealt with, the leadership of the NPP is making sure primaries are organized with strict adherence to COVID-19 protocols to safeguard the health of delegates.
For us, all these issues, we are human, and so yes, disagreement will come when official reports are communicated through the General Secretary. Appropriate actions are
Have you had any official reports of grievances?
If we are asking in reference to
the primary,
this ongoing process to conduct our primaries, yes, some people submitted petitions to the General Secretary to be forwarded to the National Parliamentary Appeals Committee, which was chaired by Mr. Peter McMahon, our former chairman, 2016 campaign manager, and still 2020 campaign manager. It tells you. It was supported by Dr. Dokufo, S.K. Boafo, Mantilizi, Madam Cecilia Abdandapa, other leading members of the party in that committee. So there were in-house discussion with all the aggrieved people, and it is expected, and they appreciated that the final decision will come from the National Executive Committee. And so by so doing, the General Secretary will issue the decisions from National Executive Committee. And it is expected that all aspirants will accept the final decision.
Okay. So there are petitions, but there are...
Petitions were received.
Okay.
Petitions were
How many petitions were received?
I think I can talk of 78, some by people who were not recommended by the vetting committee, and some by others who feel that people who had been recommended by the vetting committee has some issues to discuss, and that has gone on, and we've gone past that phase. That allowed the national chairman to call for the National Executive Committee to consider both reports from vetting committee and National Executive and the Appeals Committee.
When are you going to conclude with that as a party, so that those who have raised those petitions, put in those petitions, they will have some finality before this is convened?
Once the National Executive Committee comes out, that's the final.
When is that?
We've done that already.
Okay. So you've thrown the 78 petitions in the trash bin?
No, not that. I mean, within the 78, considerations were given. So some individuals who were not recommended by the vetting committee, the appeals committee recommended to NEC that their issue be reconsidered. And I'm saying that once the report was considered by a National Executive Committee, which the JS will issue out, it is deemed that the party has spoken.
And as churches prepare to reopen this Sunday, some are devising innovative means of complying with the 100 congregation limit imposed by President Akufo-Addo while ensuring that the virus doesn't spread. The Royal House Chapel International, for instance, plans to run a service where congregants are invited instead of the traditional way of people showing up on the day of worship. Its leader, Reverend Sam Kranche Ankra, who doubles as the vice chair of the Ghana Pentecostal and Charismatic Council, spoke at a ceremony where government presented PPEs to some churches. Mamiesi Nyameche Thompson reports.
Ahead of Sunday, government has presented Veronica buckets, face masks, hand sanitizers, soap, washing bowls and litter bins to help the churches observe the protocols announced to keep the virus at bay. Local government minister Hajja Alima Mahama, who made the presentation on behalf of government, asked the churches to ensure persons attending service are made to wash their hands before worship to help stop the spread of the virus.
Key within the guidelines was the washing of hands. As you enter and as you depart was the washing of hands. So he sent us to bring you a donation, a token donation. We know your churches are many, but this is a token. And he's presenting to you 7,000 pieces of sets, 7,000 sets of Veronica buckets. 7,000. For Christian Council of Ghana, they will be taking 2,000, set of 2,000. For the Ghana Catholic Bishop Conference, they will be taking 1,000. For the Independent Churches of Ghana, 500. National Clergy Association of Ghana, 100. Seventh-day Adventist Church, 500. National Association of Charismatic Churches Council, 800. Ghana Pentecostal Churches Council, 2,000. And the United Prayer Network, 500.
First Vice President of the Ghana Pentecostal and Charismatic Council, Reverend Sam Kranche Ankra, who is also the General Overseer of the Royal House Chapel, received the items on behalf of the churches.
On behalf of the Christian community in the nation because we are told that some of the items are going to the districts. So we are going ahead to thank His Excellency, the President, the leadership of this nation, and particularly the Ministry of Local Government, and then the Common Fund District Office. Thank you so much for your sensitivity and your leadership in providing these items, which we definitely need in this time as the restrictions on churches and social gatherings are lifted.
He said his church, for instance, will invite worshippers as a means of keeping to the rules.
My church seats about 5,000 every Sunday morning. It's so difficult. That's a challenge for the mega churches. We are still figuring how we are going to do that. I think that the consensus is that all of us will be inviting people to attend the services. No, by invitation, a phone call will reach you from the office. Hello, so and so. would you like to be in service this Sunday? Oh, yes. You have been selected to be one of the 100 members that will be in church. You know, so we'll be doing that. That's the only way. That's the only way. And then we will run multiple services, maybe first, second, 3 services maximum. If you go 4, 5, 6, the pastor will be exposing himself too much, you know, in the open and for the virus and for infection. So 1 hour, 1 hour, 1 hour, 3 services should be fine. So Royal House Chapel, this week and next week, I am putting in place some of the protocols. Disinfectation of the place, provision of some of these things that have come to get them really ready. But for prayer services, we are starting from this Sunday.
On behalf of the Muslim sect, Sheikh receives their portion and thanked government.
On behalf of His Eminence the National Chief Imam and also the representative of the leaders of our various sects and Muslim organizations in Ghana, we would like to render a very sincere and profound gratitude to you, to His Excellency the President Nana Addo Dankwa Akufo-Addo, for this wonderful gesture of support to religious bodies. This tells us that the President, as he always indicates when he comes to us to address us, that he so much attaches importance to this COVID, to the eradication of this pandemic. And the Muslim community are solidly behind him.
Nearly 120 health workers in the central region have tested positive for COVID-19. 45 of them are on admission in the various health facilities across the region, while the rest are being treated at home. Deputy Regional Health Director in charge of Public Health, Dr. Godfred Sapong, is asking health professionals to observe the preventive protocols, even among themselves, to reduce a further spread of the virus. Richard Kwejonyaku has more.
The 111 health workers are among the region's caseload that is nearing 500. Cape Coast leads the pack of cases in the region, followed by the KOMENDA at Negua municipality that has close to 100 cases. Deputy Regional Director of Health, Dr. Godfred Sapong, cites the non-adherence to the safety protocols, even among health workers, as a major factor accounting for the rising cases among health staff.
And that's where, because that's why we feel that a lot of our health workers are not, unfortunately, are not observing these protocols when they enter their communities and in their homes. And even within our health facilities, when they are interacting with themselves. And so you enter a typical facility where nurses have a changing room and they change into their scrubs. And you don't see some of our nurses, wearing the face mask when they're interacting with themselves. And that's quite worrying. And that could possibly be one of the reasons accounting for the spread among our health workers. Of course, they live in the communities. It's also possible they're picking it from the communities when they don't observe the preventive protocols.
So far, 7,963 people suspected to be having the virus in the region have had their samples taken, and out of the figure, 2,174 are awaiting their test results. Dr. Sapong listed the hotspots in the region as Cape Coast, KEA, Abuasebu Kwamankase, Ejumako, Infantiman, Ewutu-Senya, Asan North and Asan Central. He indicated the health administration takes the situation where the health staff, the very workforce that is expected to take care of the sick, getting infected very serious.
And it's quite worrying for us because if health workers go down, and they are our frontline workers, then the fight against COVID will be compromised. And that's something we don't want to, those are territories we don't want to enter into. So we're taking this a lot more seriously, and we're giving it all the necessary attention that it needs and requires. And we continue to engage with facility managers and our district directors to do the needful and provide and make sure that our health workers are observing all the necessary protocols. Every single facility in Central Region, every single facility providing essential services in Central Region has been supplied with face masks, with hand sanitizers, and they have hand washing facilities within their facilities.
The Deputy Health Director indicated their preparedness to embark on a massive testing of the population in the region to halt community spread and to avoid any overstretch of the health facilities and the personnel in the region. Richard Kwejonya-Akon, Joy News, Cape Coast.
And in the studio here in Accra, my name is Aisha Ibrahim. Now, mental health experts in the Ashanti region say they are seeing increasing anxiety disorders and depression, especially in young adults, linked to the fear of COVID-19, even as Ghana continues to see a surge in cases. They explain many young patients have conditions stemming from fear of contracting the virus and also losing their livelihoods. Ohementeria of our health desk has more in the following report.
Meet 24-year-old Frida Ejay. She is among many young people whose social life has been affected by the fear of contracting COVID-19.
My name is Frida Ejay. I am 24 years old and I live in Kumasi. I'm a service personnel. Recently, there's this COVID-19 issue. It's very, very, very scary, especially for me. Even the name causes panic to me. It has affected my personal life, social life, and even work life, to the extent that I can't even sleep, I can't eat well.
Unlike many others who are seeking psychological care, Frida is not. She hopes to wake up one day to see COVID-19 disappear.
Right now, we are hoping for a cure. If there is a cure, we know that there is hope. If not, I don't really know what to do.
Ghana has, as of Thursday, June 4, 2020, recorded 8,885 COVID-19 positive cases with 38 deaths. Ashanti region has seen its cases rise in recent days to 1,452 with 17 deaths. Out of the number, about 1,000 of the infected are between 10 and 39 years. Doctors say the trend is inspiring fear, which is affecting the mental health of many young people like Frida.
When we recorded our first 2 cases, in fact, I was really scared. That day I didn't come to work. I was sleepless.
Those who do not already have mental health issues have started having mental health issues. Just the direct effect of the COVID. The majority of them come with anxiety issues.
At the specialist psychiatric unit of the Komfanochi Teaching Hospital, doctors say they are seeing more COVID-19 mental health related cases. Daily reported cases have shot up from 10 to about 30.
Those who already have diagnosis, most of them are relapsing, and for various reasons. Some of them are afraid to come to the hospital setting, to even come for their regular reviews, because they believe that the hospital is a front line. It's where the COVID cases are, it's where the virus is, and so they don't want to even come. They wait at home until they've run out of their medication. So our old clients are relapsing. Some are coming with comorbidities. Somebody that we were treating with depression will now coming with full-blown anxiety disorder. Some of them have had businesses breaking down, going down, and they begin to think. So somebody you were managing for maybe schizophrenia and then now comes in with depression. So our mental health issues have been on the rise, both old cases and especially new cases. We are getting a lot of new cases altogether in this pandemic era.
The surge in cases is placing a strain on the already overstretched facilities and staff. Dr. Owusu-Antwi, who is also Vice President of the Psychiatric Association of Ghana, sums up the frustration of caregivers.
We are honestly overwhelmed. As mental health workers, we know our limits, and so we've put ourselves into teams. But when you come on duty, you realize that it's really overwhelming. If it has not tripled, maybe quadrupled, because we now even have to deal with
not just patients who have tested positive and have suddenly become anxious. You have to deal with their relatives. You have to deal with the healthcare provider. So if one person tests positive for COVID, there are about 4 others who suddenly start developing anxiety symptoms that you have to tackle immediately before it progresses into something more severe. And so the parents, siblings, they live with the spouse, the healthcare provider that took care of the person, all have to be brought to be seen at a goal. So our numbers are probably even quadrupling.
At the regional level, the Mental Health Directorate says mental health cases, including generalized anxiety, has gone up. Depression, which did not show in the first 5 cases in 2019, now sits third in the psychiatric cases recorded in the first quarter of 2020.
If you look at the figures as compared to 2019, you can see that the cases are increasing. Because in 2019, from January to June, we had 5,180 cases. That is new cases of mental illness. Then in 2020, from January to April, we have 4,022 new cases. So you can see that we have 2 more months to end up with the half year. But if you compare the figure to the 2019, January to June, you can see that this figure is a bit higher.
Experts warn the number of COVID-19 related mental illness could quadruple in the coming months. The situation calls for immediate attention. From Kumasi, for Joy News, Ohime Nteria reporting.
20 out of 26 persons who tested positive for the coronavirus in the Upper East region have now fully recovered. Although this is good news, the regional director in charge of public health, Dr. Josephat Nyuzagli, is worried the recovered patients could face stigmatization in their various communities. To help advocate against such stigmatization in the region, the Participatory Action for Rural Development Alternatives, PADA, has taken the initiative to provide some logistics and to partner with the Ghana Health Service to educate people in rural communities. Correspondent Albert Story has more.
The Participatory Action for Rural Development Alternatives, PADA, is a development-oriented non-governmental organization which operates in the northern part of Ghana, providing opportunities for rural people to access quality health, education, sustainable livelihoods, and other social amenities. As part of their contribution to the fight against the spread of the coronavirus, PADA donated some personal protective equipment to the Upper East Regional Health Directorate. At a brief ceremony to hand over the items, the Upper East Regional Director in charge of public health, Dr. Josephat Nyuzagli, said, out of the 26 persons who first tested positive for COVID-19 in the region, 20 had recovered and were discharged and sent back to their communities. He was, however, worried that though this was good news, these recovered COVID-19 patients could face stigmatization from community members or even their own family members if education was not intensified at the community level.
As a region, we have done a lot regarding our case investigations. So far, we've investigated 1,501 cases. And out of this, we've received laboratory feedback for 1,429. Out of this, 26, as you are all aware, were positive. And the remaining 1,403 were negative. Okay. Of the 26, we admitted 20 of them into our treatment center. And as we speak, they have all recovered and we've discharged them back into the communities. One issue that we have to look at as a region has to do with the stigma. And you can only fight stigma when you provide adequate information. People know about the disease, they know how to prevent it. And then we can all play our little roles to eliminate stigma in our communities.
In response to the concerns expressed by Dr. Nyuzagli, the director of PADA, Dr. Michael Wombiego, revealed that in addition to the donation of PPE, PADA was supporting the sensitization of people in rural communities on all issues relating to COVID-19.
Today, we are going to fight the pandemic in two ways. One way is to gather some few logistics, as you are seeing now, to give to the Ghana Health Service to be able to distribute to our target communities. Then they will use this one as part of the national prescribed protocols. And the second part entails sensitization and education. And here, PADA is going to train some selected few within all our target communities to go out to the communities, the sections of each community, to educate them about the pandemic. Fortunately for us, we have made some jingles that we play in the various radio stations. And we have done this in 3 major languages.
The items donated by PADA included 80 sets of personal protective clothing, 20 non-contact thermometers, 30 Veronica buckets, 400 hand sanitizers, 60 gallons of liquid soap, and 20 handheld public address systems for public sensitization purposes. They were received by the Deputy Upper East Regional Director in charge of Public Health for onward distribution to healthcare facilities in the region. For Joy News, Albert Sori, reporting from Bolgatanga.
The Upper West region, but this time with the regional minister, Dr. Hafiz bin Saleh, who is worried about the spate of smuggling of government-subsidized fertilizer for Planting for Food and Jobs program to neighboring Burkina Faso. He said with the closure of the country's borders, coupled with the increased presence of the police and military personnel in the Sisala East and West municipality, he expects the practice to stop. Now, addressing agric import dealers in the Upper West region, Dr. bin Saleh said he will not hesitate to recommend the revocation of the license of any supplier who is involved in the smuggling. Join us as Upper West Regional Correspondent Rafiq Salam reports.
The National Fertilizer Subsidy Program is one of Government of Ghana's major agricultural interventions, which the Ministry of Food and Agriculture has been spearheading since 2008. However, its implementation is now fraught with challenges. Key among them is the increasing smuggling of the commodity to neighboring countries for sale at higher prices. Last year, for example, several dozens of truckloads of fertilizer bound for farmers in the Upper West region were diverted to some neighboring countries. Minister for Food and Agriculture, Dr. Owusu Afriyie-Akoto, was furious and on the verge of crying when he listened to harrowing tales from farmers who do not receive fertilizers to grow their crops.
My heart was bleeding yesterday when I heard that farmers in Tumu had to come around Tumu, had to come and spend 3 nights in front of the office of the ministry just so that they can get a coupon to go and get fertilizer. This is not what I started this whole program with. It's very, very sad. You're all sitting there very quiet. I don't see any emotions in your faces. For me, I could cry. To be honest, I could cry.
It however appears that those unscrupulous persons involved in the smuggling are not remorseful of their act and are bent on continuing the illegal trade. These 2 heavy trucks with registration numbers GB 8461-12 and GB 2409-12 are carrying 2,000 bags of fertilizers. Each bag of fertilizer weighs 50 kilograms, twice more than the kilos required for farmers in the northern belt of the country. Suspicion from the national security then began and the trucks were impounded. Ben Suri is the Upper Security Liaison Officer.
Fertilizer that are bagged in 50 kilogram bags, that have a weight of 50 kilogram bags, are not intended for the 3 northern regions because of smuggling. Those that have been certified and can be used in the region should be not more than 25 kilograms. What we have here, each truck carries 1,000 bags, and each of the bags is 50 kilograms. So they have violated the regulation, and they have found their way in the wrong region, and for that matter, going by the regulations, they stand seized.
Owner of the 2 truckload of the fertilizer, B.B. Slow, says he's unaware of the 50 kilogram carried by the two trucks.
I don't know the goods is 50 kg. Me, I know the guy is supplying me 25 kg. That thing come and reach here, it be 50 kg. That day I just beg, it will send that thing back to the Nkransan. I flew there to them. It load 25 kg to me back.
Upper West Regional Minister Dr. Hafiz bin Sali, who led a team to impound the two vehicles, refused to speak on the issue. He, however, opened up on the issue during a meeting with chiefs from the Lower traditional area.
Some unscrupulous persons try to smuggle these fertilizers outside of the country, and that is not good enough. I therefore use this opportunity to call on all of you to be watchmen. Let us watch against these saboteurs of the nation. Anyone who is involved in the smuggling of fertilizers outside of this country should be brought to book.
Reporting for J News, Rafiq Salam. Wow.
I'm back in the studio and in Accra. My name is Aisha Prime. We're still watching Joy News Prime. We're back shortly with the second segment of business. Ghana Chamber of Commerce has donated food and sanitary items worth 20,000 cedis to support inmates of the Nsawam Male Prison Facility amid the COVID-19 pandemic. President of the Chamber, Dr. Nana Appiagyei Dankwaso I, who presented the items, says corporate Ghana must raise up in supporting the vulnerable in society in order to cushion them from the shocks of the virus. There's more in the following report.
President of the Ghana Chamber of Commerce and Industry, Dr. Nana Appiagyei Dankwaso I, has donated some food and sanitary items worth 20,000 cedis to the Nsawam prisons in the eastern region. According to him, now is the time for corporate Ghana to provide all the fiscal support for the fight against COVID-19.
It has become part of my philanthropic activity. And so we visited here the first time, the second time, and today is the third time. We are doing this. We have selected May, the month of May, dedicated to the prisoners.
Receiving the items, Assistant PRO for the Male Nsawam Prisons Facility, ASP Nanavi Solomon, urged businesses and other good hearts to support the prison service as they remain hotspots for the spread of COVID-19.
This, we believe, is still a timely intervention that will go a long run to help our dear brothers inside this facility. So we would love to say a very big thank you now, and also use this opportunity to call on other organizations and also institutions to come on board and help.
Meanwhile, the Ghana Health Service says it is working closely with prison authorities to ensure that no correctional facility in the country records a case of COVID-19. This follows concerns of a possible spread of the virus, considering challenges of overcrowding at various prison facilities in the country.
Many corporate institutions are shifting the preference for advertisement to digital platforms. In the face of the COVID-19 pandemic, Private Advertisers Association in the Ashanti region says the trend is affecting the operations, resulting in loss of revenue. President of the association is Emmanuel Kofinti.
Now, many companies are moving into social, digital advertisement, which they believe many people are holding phones. So Instagram, Facebook, Twitter, and it's not going to even agencies. It's going to celebrities who have followers. So agencies are losing it unless they see celebrities for a deal. And activations, which is part of advertisement. We have sales team with speaker, van, just to go around the market to even sell. They are also suffering. Why? Because of we are experiencing social distancing. So how do you expect sales team or your sales reps to go out there and do promotion? So all aspects of our advertisement is suffering, apart from digital. Now digital, whether you like it or not, now digital is what is going on now. YouTube, Instagram, Twitter. If you are an advertiser and you are not there, trust me, you will lose it in the coming years.
Anything you want to
I would just advise my fellow advertisers to find other means of, getting their clients some exposures. I mean, visibility, because outdoor, like I said, now it's out. Radio, five people are listening to radio. They can advertise, but no, who is selling? Yeah, so people should find other ways of helping their client to get those kind of mileage.
In other news tonight, contractors working on the Eastern Railway line from Tema to Mpakadan are required to provide a new date for completion for work. The line, which is expected to join Burkina Faso, is about 60% complete, but contractors, AFCON Limited, had to put the project on hold as some positive COVID-19 cases were recorded at one of the project sites. According to the Minister of Railway Development, Joe Gatti, government has requested for a new completion timeline.
From the way they are working, they believe that they can finish in August of this year. Now, at that time, they had done about a little over 50% of the work. But they had also done quite a bit of the formation. The formation is what is done before the track is put on it. In January and February, what they did was that they spent a lot of time working on the barge and so on. And they, in fact, launched the barge, which will allow them to do the bridge over Volta. If you are going to the Volta region just around Japo, you see that they worked on both sides of the road. But unfortunately, they were affected by this virus. What is happening is that this morning, the Ghana Railway Development Authority met with them. And we've asked them to give us their proposal for their new timelines. But like all the contractors that we work with have said to me that construction of that nature is not like a car that you can just switch it on and off. When you demobilize to remobilize, it takes time. And so we've lost significant time. And for those who say that it will be completed in August, please, that is not the situation. In December, they said it will be completed in August. Even what you are wearing, your nose mask you are wearing, must show you that the world has changed. We have all experienced this unfortunate incident that has changed our world completely. And also, they also had people who had the virus, so they had to stop working. And so Ghana Railway Development Authority will sit down with them, and when the new figure comes out, when the new date comes out, we'll make it known to the people of Ghana.
Friday and Thursday is how trading activities ended on the commodity market. Brent crude inches up, selling at $42.01 a barrel. That's more in the commodity news update. End business for the week with me, Sandra Esinam Apeno. Log on to myjoyonline.com/business for more business news updates. Do enjoy your weekend, but stay home, stay safe, and stay beautiful.
Hello, good evening, and welcome to the second edition or second part of the sports segment here on Prime with me, Oreko Ampofu. We do start from the Bundesliga, which resumes this weekend. Match day 30. We know the Bayern Munich are 7 points ahead of Dortmund. Will they be able to wrap up their title? Leipzig will be playing Paderborn. Bayern Munich travel to Bayern Leverkusen, with Borussia Dortmund hosting Hertha Berlin. And then on Sunday, Werder Bremen would be at home to Wolfsburg as Cologne travel to face Augsburg. I don't think we would see a title race probably more dramatic than that. But on that dramatic note, let's head to the Joy Sports Twitter account, where we did also ask for some bit of drama. If Ghana were awarded a penalty in the final of the Africa Cup of Nations in the 90th minute, who would you want to take that penalty if you were the coach? Options were Samuel Jan, Dede Ayew, Thomas Partey, and Jordan Ayew. So far, there's been over 300 comments so far. We'll try and get a few of them. Factual Mubarak says Jordan has a 100% conversion rate. Gary L. Smith, who usually presents the sports here, he goes for Jordan, and more options saying Jordan. And yeah, we do have more people saying Jordan. So you can head to our Twitter account at JoySportsGH to, let us know what you think. Is there Samuel Jan, Thomas Partey, Andrea Ayew, or Jordan Ayew? But that's all the time would allow us for here on the sports segment on Prime. My name is Oreko Ampofu, and do have a fantastic weekend.
All right, and that'll be all for the bulletin for tonight. I'm Israelai, anchoring from home. Over to you, Aisha, in the studio.
And my name is Aisha Ibrahim. Many thanks for watching. Enjoy the rest of our programs.